If you are over 65 and you're not taking these five vitamins, doctors say you could be setting yourself up for weaker bones, a declining immune system, fading memory, and energy levels that drop lower every year. And the most alarming part is that studies show the majority of seniors are deficient in at least one of these essential nutrients without even knowing it. Here's something I see in my practice all the time. A patient over 65 comes in feeling exhausted, foggy, and achy. They tell me their energy has been declining for months. Their joints hurt more than they used to. They catch colds more easily. Their memory is not as sharp as it was a year ago. And when I run their blood work, almost every single time, we find that they are dangerously low in one or more critical vitamins. The frustrating part is that these deficiencies are almost always preventable. But because the symptoms creep in so slowly, most people just assume it is aging. They never think to check their vitamin levels. My name is Dr. Michael Williams, and I have spent years helping seniors understand the nutritional gaps that develop as we age. And more importantly, how to close them safely and effectively. Because here is the truth that most people do not realize. After the age of 65, your body changes in ways that make it significantly harder to absorb and use the vitamins you get from food alone. Your stomach produces less acid, your digestive system slows down, your kidneys filter nutrients differently, and your skin becomes less efficient at producing vitamins from sunlight. All of this means that even if you are eating a healthy, balanced diet, you may still be falling short of what your body needs. In this video, I am going to walk you through the five vitamins that doctors say are most critical for seniors over 65. I am going to explain exactly why each one matters, what happens when you do not get enough, and how much you should be taking. I am also going to warn you about two common vitamin mistakes that seniors make that can actually be harmful. And the third vitamin on our list is the one that surprises people the most because nearly 80% of seniors are deficient in it. So stay with me through the entire video because getting this right could be the key to feeling dramatically better in just a few weeks. Let us start with the first vitamin, and it is the one that I consider absolutely non-negotiable for every senior. It is vitamin D. Now, you have probably heard about vitamin D before, and you might even be taking it already. But what most seniors do not realize is just how important vitamin D is for virtually every system in your body, and how common severe deficiency is in people over 65. Vitamin D is essential for calcium absorption, which means it is directly responsible for keeping your bones strong and reducing your risk of fractures. A fall that might result in a bruise for a younger person can result in a broken hip or wrist for a senior with weakened bones. And vitamin D deficiency is one of the leading causes of bone weakness in older adults. But vitamin D does far more than just protect bones. It plays a critical role in immune function, helping your body fight off infections and illnesses. It supports muscle strength, which is essential for balance and preventing falls. And emerging research suggests it may play a role in mood regulation, cognitive function, and even heart health. The problem is that after 65, your body produces significantly less vitamin D from sunlight. Your skin loses its ability to synthesize vitamin D efficiently, and many seniors spend more time indoors, reducing their sun exposure even further. Food sources of vitamin D, like fatty fish and fortified milk, rarely provide enough on their own. That is why most doctors recommend that seniors over 65 supplement with vitamin D3, typically at a dose of 1,000 to 2,000 IU per day, although your doctor may recommend more based on your blood levels. I recommend getting your vitamin D level tested through a simple blood test. The optimal range is generally considered to be between 40 and 60 nanograms per milliliter. If you are below 30, you are considered deficient, and your doctor may recommend a higher dose to bring your levels up more quickly. But vitamin D alone is not enough to protect your bones, because the second vitamin works hand in hand with it, and many seniors are taking vitamin D without it, which reduces the benefit significantly. The second vitamin is vitamin K2. Now, this is a vitamin that most people have never heard of, and even many doctors do not routinely discuss it. But researchers are increasingly calling it one of the most important vitamins for seniors, and here is why. Vitamin D helps your body absorb calcium, but once that calcium is in your bloodstream, your body needs direction on where to put it. Without vitamin K2, calcium can be deposited in your arteries and soft tissues instead of your bones. This is called vascular calcification, and it is a major contributor to arterial stiffness, reduced circulation, and increased cardiovascular risk. Vitamin K2 essentially tells calcium where to go. It activates proteins that direct calcium into your bones and teeth where it belongs and away from your arteries and organs, where it can cause damage. Taking vitamin D without vitamin K2 is like putting fuel in a car without a steering wheel. The energy is there, but it is not going where it needs to go. Good dietary sources of vitamin K2 include fermented foods like natto, certain aged cheeses, and egg yolks, but most seniors do not get nearly enough from food alone. A typical supplemental dose is 100 to 200 micrograms per day. However, and this is very important, if you are taking blood-thinning medications like warfarin, you must talk to your doctor before taking vitamin K2, as it can interact with these medications by affecting blood clotting. And now we come to the third vitamin, and this is the one that surprises almost everyone. It is vitamin B12. Studies consistently show that between 20 and 40% of seniors over 65 are deficient in B12, and some researchers believe the true number could be even higher because the standard blood test for B12 can miss early-stage deficiency. Here's why B12 deficiency is so common in seniors. As you age, your stomach produces less of a substance called intrinsic factor, which is essential for absorbing B12 from food. Even if you are eating plenty of meat, fish, eggs, and dairy, which are the primary dietary sources of B12, your body may not be able to extract and use it efficiently. Additionally, certain common medications, including metformin for diabetes and proton pump inhibitors for acid reflux, can further reduce B12 absorption. The symptoms of B12 deficiency are wide-ranging and often mistaken for normal aging. They include fatigue, weakness, brain fog, memory problems, difficulty concentrating, tingling or numbness in the hands and feet, unsteadiness, and mood changes, including depression and irritability. In severe cases, B12 deficiency can cause permanent nerve damage and significant cognitive decline. The fact that these symptoms overlap so heavily with what people expect from aging is exactly why the deficiency goes undetected for so long. Most doctors recommend that seniors over 65 supplement with B12, typically in the methylcobalamin form, which is more easily absorbed than the cyanocobalamin form found in many cheaper supplements. A daily dose of 1,000 to 2,500 micrograms is common for seniors. If your deficiency is severe, your doctor may recommend B12 injections, which bypass the digestive system entirely and deliver the vitamin directly into your bloodstream. I cannot stress this enough. If you have been experiencing fatigue, brain fog, or memory issues and you have not had your B12 level checked, please ask your doctor for a test. It is simple, inexpensive, and the results could explain symptoms that have been bothering you for months or even years. The fourth vitamin is one that plays a crucial role in immunity, energy production, and muscle function. It is magnesium. Magnesium is involved in over 300 biochemical reactions in your body. It helps regulate blood pressure, supports bone health, maintains nerve and muscle function, and plays a role in blood sugar regulation. It is also essential for producing energy at the cellular level, which is why magnesium deficiency is one of the most common causes of unexplained fatigue in seniors. Studies suggest that more than half of adults over 65 do not get enough magnesium from their diet. This is partly because magnesium-rich foods like nuts, seeds, leafy greens, and whole grains may be consumed less frequently by seniors, and partly because the body absorbs less magnesium as we age. Certain medications, including diuretics and proton pump inhibitors, can also deplete magnesium levels over time. Symptoms of magnesium deficiency include muscle cramps, especially in the legs at night, fatigue, weakness, irregular heartbeat, difficulty sleeping, and increased anxiety. Many seniors who suffer from nighttime leg cramps find significant relief when they address a magnesium deficiency. The recommended supplemental dose for seniors varies, but most doctors suggest 200 to 400 milligrams per day. Magnesium glycinate is generally considered the best form for seniors because it is well absorbed and least likely to cause digestive upset. Magnesium citrate is another option but can have a laxative effect at higher doses. Taking magnesium in the evening may also help improve sleep quality, as it has a natural calming effect on the nervous system. And the fifth vitamin, which rounds out our essential list, is one that most people associate with fighting colds, but that plays a much broader role in senior health. It is vitamin C. While vitamin C is commonly known as an immune booster, its importance for seniors extends far beyond cold prevention. Vitamin C is a powerful antioxidant that helps protect your cells from damage caused by free radicals, which are unstable molecules that accumulate as we age and contribute to inflammation, heart disease, and cognitive decline. Vitamin C is also essential for collagen production. Collagen is the structural protein that holds your skin, joints, tendons, and blood vessels together. As you age, collagen production naturally decreases, and adequate vitamin C is necessary to support whatever production your body can still manage. This is why vitamin C is important for wound healing, joint health, and maintaining the integrity of your blood vessels. Additionally, vitamin C significantly improves your body's ability to absorb iron from plant-based foods, which is important for seniors who may be at risk of iron deficiency anemia. And recent research has suggested that adequate vitamin C intake may be associated with better cognitive function and a reduced risk of age-related cognitive decline. The recommended daily intake of vitamin C for seniors is generally 75 to 90 milligrams, but many doctors suggest that seniors aim for 500 to 1,000 milligrams per day for optimal benefit. Good dietary sources include citrus fruits, bell peppers, strawberries, broccoli, and tomatoes. Supplementation is safe for most people, but doses above 2,000 milligrams per day can cause digestive issues and should be avoided. Now, before we wrap up, I want to address the two common vitamin mistakes I mentioned at the beginning, because these are just as important as knowing which vitamins to take. The first mistake is taking too much of certain fat-soluble vitamins. Vitamins A, D, E, and K are stored in your body fat and liver, which means they can accumulate to harmful levels if taken in excessive amounts. While this is relatively rare with sensible supplementation, it does happen, particularly with vitamin A. Excessive vitamin A can cause liver damage, bone loss, and increased fracture risk. Always follow recommended dosages and work with your doctor to monitor your levels. The second mistake is assuming that more supplements are always better. Some seniors take a dozen or more different supplements every day, many of which overlap in ingredients, interact with medications, or are simply not needed. More is not always better when it comes to vitamins. The goal is to identify your specific deficiencies and address them with targeted supplementation, not to take everything on the shelf and hope for the best. A good starting point is to get comprehensive blood work done and work with your doctor to create a supplement plan tailored to your individual needs. Let me quickly recap the 5 essential vitamins we covered. First, vitamin D3 for bones, immunity, and overall health, typically 1,000 to 2,000 IU daily. Second, vitamin K2 to direct calcium into bones and away from arteries, typically 100 to 200 micrograms daily. Third, vitamin B12 for energy, brain function, and nerve health, typically 1,000 to 2,500 micrograms daily in the methylcobalamin form. Fourth, magnesium for muscle function, sleep, blood pressure, and energy, typically 200 to 400 milligrams daily. And fifth, vitamin C for immunity, antioxidant protection, and collagen support, typically 500 to 1,000 milligrams daily. If you take nothing else from this video, take this. Get your blood work done. Find out where your levels stand, and then work with your doctor to address any deficiencies with the right supplements at the right doses. It is one of the simplest, most impactful things you can do for your health after 65. If this video was helpful, I would truly appreciate it if you subscribe to this channel. I create new videos every week designed to help seniors navigate their health with confidence and clarity. And if you know someone over 65 who has been feeling tired, foggy, or run down, please share this video with them. A simple vitamin deficiency might be the explanation they have been looking for. I am Dr. Michael Williams. Thank you for watching, and I will see you in the next video. Take care of yourselves.